Histology Abroad, NSH has chats with members from around the world, in countries right next door and those halfway across the globe. We ask them how they got into histology, the challenges and opportunities they see, and how COVID-19 has impacted them. While there are many differences, the commonalities will surprise you. I'm here with Clara Pecorella and Cristina product specialists from Diapath in Italy. Would you guys like to introduce yourselves, tell us a little bit about where you're from, how you got into histology, and what it is that you currently do?
Yes, hello everyone. My name is Cristina D'Amico. I am Italian and I am a product specialist in Diapath, as you mentioned. Diapath is producer of consumables and instruments for anatomic pathology laboratories. I am quite new in this field as I joined Diapath just a couple of months ago after my experience in histology as a registered biomedical scientist in UK. I worked for 6 years in a histology laboratory in London, in St. Thomas's Hospital. And in 2020, I have decided to apply my knowledges in the commercial field, joining Diapath. This decision was made for pursue a new challenging career experience and something different from the laboratory routine. I have completed my studies in both countries, so half Italy and then in UK, as I was based there for about 8 years. So this is my start in histology in the field, which is different from Clara.
Hi, I'm Italian and I'm a product specialist at Diapath too. And I worked in histology lab for several years and in Sicily, and I moved career in 2015, joining in Diapath.
Okay, awesome. So let's talk a little bit about Italy in general. What's the process for someone to become a histologist in Italy?
Okay, in Italy, in order to become an histotechnologist, a student must complete a bachelor degree in biomedical laboratories technique. And to access this course, an entry test is required. As the number of the students is limited, only 30-40 students are allowed in the course, making the access very competitive and strict.
Yeah, so basically during those 3 years of the bachelor, students must complete a practical training program in all the different fields of laboratories. So for example, histology, biochemistry. So the students go to the lab to do this kind of training program. At the end of the course, so of the 3 year of the bachelor, student will discuss like a final project. They will carry out an exam and enable them to finish their study and to be a registered histologist, like a biomedical scientist in Italy. So they are allowed to work from the next day after the degree. In every hospital and as a biomedical scientist. So for this reason, when I moved to UK, this is my experience, I didn't have to do a registration portfolio because it was already included in my degree, which is different from the UK system where biomedical scientists after bachelor have to start this kind of registration portfolio in order to work as a registered biomedical scientist. So if the two systems or degrees are different, I would say in Italy is probably a bit more complete respect to UK, just because it's avoiding the step of this portfolio. But yes, so both of us, we have done the same bachelor degree in Italy, and this is the process.
So I was actually talking to someone from the Netherlands earlier this morning, and they have the same kind of process where as soon as you get your degree, you're certified to work. You don't have to go and pursue an additional exam afterwards to become certified.
Yeah, it's definitely like much easier for access definitely to work. So in UK, for example, after degree, they are starting as assistant biomedical scientist because of course they are not allowed to work as a registered, but then, and it will take time to intake those kind of registration portfolio. They will complete probably after 3 years, 2 years, I would say, is the roughly time where they can actually work as registered. Yes, so I think the system is better in Italy.
So with that, are you required to complete any continuing education then? So you don't have to earn any kind of continuing education credits after you're already in the field for a while?
Well, definitely to maintain the certification is required from the body that to follow and always to keep update your knowledge. So I think yes, in Italy and in UK there are two different regulating body. And Clara will talk about the Italian one.
Yes, in the body regulating biomedical laboratory technician is very new. In fact, from 2018, a registration is required to practice the profession. The process of a registration doesn't require any test or exam. It is only based on degree and personal information and fee payment. The national registration must be renewed every year.
Yes, and they're required to continue improve your knowledge and follow courses, always to keep update. Same is for for UK. So there are two registration bodies. One is the HCPC, which is the Health and Care Professions Council, where it's essential this registration to work as a biomedical scientist. And then there is also the IBMS, which is very structured body, which is the Institute of Biomedical Science. And this IBMS is regulating especially the CPD program, which is the continuous professional development. And it is to keep demonstrating the learning and development during the career. And there is this program where biomedical scientists need to record every courses that they have been attended. And also, for example, if you have read a paper or anything that you study for demonstrate good professional practice. So this is something that is checked and is required by biomedical scientists.
So it's very similar to the United States. They have the same.
Yes.
Yeah.
Yes.
So are there any local groups in Italy that provide histology specific resources?
Yes, in Italy there is a local group specific for histology technician and cytology, which is ITIC. ITIC is an Italian association of histotechnologists and cytologists. There are also other two groups, PITELAB and iBlast, but they are more generic, involving in the different technician classes in all the field. And NSH is an association known worldwide, and Diapath participated to his annual symposium. Last year, Diapath won the special stains contest with the MSB special stains performed by me, and we are very proud for this acknowledgement.
Yeah, that's right. I remember I talked to you.
Yes.
I think that was 2019 that you guys won the special stain contest. It was a very pretty stain. So what about in UK? Were you involved with any local groups there?
Yeah, so main involvement were the IBMS, the Institute of Biomedical Science. And as I mentioned before, there is a congress every 2 years. It is a gathering of course, biomedical scientists from all the country. And it is very interesting to see in all the fields papers and presentations. It is a very important event. But yes, I think it's IBMS is the main one.
So let's talk a little bit about the training programs again for a second. Is there a shortage of histologists and histology training programs there like there is in the United States?
Well, in UK, I know there is a shortage of histologists. In fact, I can say, as I work in London, histologist technicians are coming from all the countries to work in London. And they are employed through agency and also a private employee. So yes, I would say in UK there is a shortage. Instead, in Italy, I don't think the situation is not like that.
In Italy, there is not shortage of histologists. Instead, we have more graduated people than works opportunities. There is just a shortage in histology training, as there is not a specific specialization. Yeah, it's different from UK.
Right. So since there's more of a general education for Italy in biomedical science,
Yes,
there's a lot more people who go into it.
Yeah, so instead in UK there is a specialization in histologists with specialist portfolio training, which is for cellular pathology, which gives very detailed field of histologist to become a specialist biomedical scientist in the field, and it is very useful for that.
So are you finding that your labs are becoming increasingly automated? What impact has that had on your lab's daily work?
Labs are becoming more automated. During my experience in the lab, the only things not automated were the cutting, which was still manual, the embedding, and the histochemistry. The impact of automation is an increased productivity, a reduction of errors and variables, operator dependence.
Yeah, and also with the increasingly amount of paperwork that are required, especially with the ISO inspections for compliance with ISO, the laboratory has to pass post inspections and a lot of tests. And I have to say, histologists are very fully involved in this process, and definitely automation can be something to help operators to focus more in quality and standardization of histology techniques, and also on the recording and paperwork. Fortunately, is becoming more, rules are becoming increased, and this can be something that could help.
So has this changed the training that histologists have to receive to focus more on being able to troubleshoot the machinery, as opposed to having to perform all of the techniques by hand?
Oh, yes. Yes. So definitely the training is different now. For example, the producer, the companies are providing training most of the time themselves to make sure that staff is well trained in those machines, because machines are becoming very difficult and more complex also to understand. The software is becoming bigger, so it's not an easy training. Sometimes it requires days or weeks. So it is something that companies are looking at to make sure that staff are trained very well in order to avoid any issues, and especially to troubleshoot instruments in an independent way. But yes, it's something training now are much more different respect to before.
One other question just related to COVID. Has that changed your work at all?
Well, to COVID, so histologists in general, for example, I was working in histology laboratory in London during COVID pandemic. And I can say that routine work has reduced remarkably due to reduction of clinic appointments. So our work has becoming it's a bit sad to say, but it's becoming in a second level, because of course priority is to fight against COVID and give support to those departments that really need extra help. So some staff members work in histology, sometimes they had to change, they've been moved to other laboratories that they were overloaded with work. For example, biochemistry or virology, definitely they were increased the workload in a very high, for the high demand. But COVID of course has changed and had an impact in all the fields, but with minor impact in histology, because was not the one related to the issue.
Yeah, the same in Italy.
Yes.
Yeah, it's kind of the same in America. We had, so when they shut down elective surgeries, some of our people were furloughed, and but now they've mainly gone back to work with social distancing and all
yes.
that.
Yeah, especially for labs that they are small, like it was very difficult to maintain social distancing. Sometimes labs, they have a small space to work with. And I would say that this working, like reduction of work, will result in a very high demand probably next year after the pandemic will end, where they need to, doctors and hospital, they need to back again to all the patients that they have been delayed during this time. And probably there will be a higher increase of workload again, like probably more than before.
Right. Yeah. I think that's probably very likely.
Yeah.
So last question that I have for you, what other challenges do you see in the future for histology?
Well, the challenges that I would see probably is, well, in the future of histology, our challenge is to remove completely toxic substances in the laboratory routine. So I think this is one of the main challenge. There are lots of alternatives out there now that can substitute carcinogenic substances like formalin and xylene. And today it is possible to work in a safer environment. Diapath can offer some of those alternatives. And as a company, we are working very hard for making them cost effective without compromising quality, of course. The challenge is to convert also laboratory to these new substances, which is a process that will require time and effort from histology companies, and also from the laboratories and from the staff.
All right. Thank you.
Thank you for the questions and for the time today.
Yes, thank you guys for being here. It's been very informative.
Thank you.
Thank you.